Frustrated and disheartened.
Joshua Matchett says the news from Tender Care Living Centre isn't surprising, and he worries for families dealing with the stress. Matchett's father died in April at his long-term care facility in Georgetown, Ontario. Residents are supposed to be checked hourly, but his body was only discovered 6 hours later. An inspector's report concluded the home, quote, failed to protect Travin Matchett from neglect by staff.
It seems that, elderly citizens are no longer a productive part of society, so we can just put them under a rug.
A sentiment echoed by those in the field.
We're going to have catastrophe and carnage within the second wave of COVID-19 in long-term care homes.
This summer, the Commission into Ontario's long-term care facilities heard brutal testimony from residents and healthcare workers about shortages of staff, proper protective equipment, and appropriate oversight, problems which persist to this day.
We should not be having homes where you're having dozens of deaths inside a long-term care home this far into the pandemic. It's unacceptable and it's unforgivable.
They certainly could have rapidly started to recruit and train people to work in long-term care.
This sociologist points to Quebec, where a recruitment campaign for orderlies was launched in May. Almost 7,000 additional orderlies are now working in homes across the province. But Ontario's recruitment efforts seem stalled. Now there are calls for the Army to step in.
They need to be there as long as we see incidences of neglect and rapidly rising infection and death rates.
But the Army needs to be invited.
Deployments of the Canadian Armed Forces or of the Red Cross is always done at the request of the provinces in question.
Ontario's Solicitor General confirms no request for the Army has been made, at least for now. Sarah Levitt, CBC News, Toronto.